Hi, this is Dr. Girish AC, consultant plastic and cosmetic surgeon. I am heading Curls and Curves Cosmetic Surgery Center, Vijayanagara, Bangalore. So today I am going to discuss about facelift procedure. So in the facelift, there are several facelift procedure techniques are there. So today I am going to demonstrate about deep plane facelift. So which is almost the best or advanced the result oriented technique for facelift. The facelift procedure is done for the to correct the signs of age like wrinkles, folds, marionette lines, jowls, deep nasolabial folds, and also in the neck the deep bands and the excess fat deposition will be there, and around the face some wrinkles, the fullness, bulges, and also the sagging of the lateral eyebrow, the side of the eyebrow. So we are going to correct everything. So we are not just going to correct only mid face or only the part of the face. So we need to correct the whole face. So as a whole, one single unit, face and the neck together. So thereby the overall the improved appearance will be there. The everyone's question will be is that like how far we can improve these signs. It's more or less around 15 to 20 years improvement for any given age can be improved. And the next question is how long these results are going to stay. So the results are going to stay for more or less lifetime, but always some the age, the whatever the years of difference is maintained. For example, if they get the surgery done around 50 years, and the improvement will be given to an extent of about around appearance of 30 years age, means 20 years difference. So when they become 70, still they look around 50, age of 50 years appearance. This difference is maintained, but for any given age, always there will be an improved appearance. So the facelift consists of several techniques. The facelift proper itself. So here we make an incision in front of the ear, and which may just extend behind the ear also to cover the entire face here. So this is in the hidden area. So once healed, it won't leave behind any scars. It looks very natural. So then for the blepharoplasty, so we make a small incision in the lower lid, in the just below the lower eyelid margin, and even this will also be not notified in the later part once it is well healed. For the brow lift, we are following the gliding brow lift, where we make a small incision in the hair bearing area, and so that this incision, the very small incision around 3 millimeters, and that is also hidden. So thereby, and in the plane below the skin level, we dissect and do a proper eyebrow shaping. It is not just eyebrow lift, but also eyebrow shaping. So whenever they smile, so there will be a lot of wrinkles around the eyes will be there. So with this eyebrow lift, lateral eyebrow lift, the wrinkles will disappear or will not appear when they smile. So more or less, in addition to this, we make a small incision in the neck, just below the chin area in the submental crease. So with that, we are going to do the liposuction of the entire neck, and also the neck band, that is a platysmal bands, is corrected by plication. So even that will improve the neck appearance. So the overall the face and neck, there will be a youthful appearance will be there. So this procedure is done under general anesthesia. We usually take around 4.5 to 5 hours to complete all the techniques, and all the techniques need not be done to everyone. So that depends on the requirement. If the person may just require a facelift, or one may require facelift, neck lift, brow lift, blepharoplasty, and with few when the volume is less, which happens naturally with the age. So that we also improve the volume by fat grafting. So all these techniques are made use according to the requirement of a given person. So the finally our aim is to improve the aged signs. So this aged signs usually we done in the age group of 50 to 60, but so it can also be done early when there is early age changes. It can also be done later between 60 to 70 years where the advanced the signs are there. So the whole spectrum between 30 years to 70 years, more or less the facelift will help them. Rarely for youth people where some conditions called as cutis laxa, where the skin is very loose in that situation, or they have some early changes of the age. So for them also we can offer this improvement with this facelift procedure. So then I will explain about the procedure step by step today. So after the anesthesia, so I have done already marking for the client for the today's case. So then once the anesthesia is given, I am going to show about the marking and how much difference or what difference we are going to achieve. So this is the today's case for facial rejuvenation. She is around the age of 52 years. She has come with the complaints of signs of aging. So what are those signs of aging? That is a deep, her main complaint is deep nasolabial fold, and this is the marionette line. So, and there are some wrinkles around the eyes. The whole face is down. This is called as mobile smash layer. So this is a mobile structure. So with the age, this is the one which comes down and forms a jowl here. So it forms a jowl here. There is a descent of the fat, one thing, and another thing is there is a loss of volume, that is a loss of fat also. So the combination of both. So in this case, this is created the jowl like this. Since she is in the lying down position, these things cannot be well demonstrated. But this is a mobile structure and this is a fixed structure. More or less, this is less mobile and the less age signs will be here. But more signs will be in the cheek area. So there is a even volume loss in the lower orbit, and that is in the lower eyelid part. So this her the lateral eyebrow is drooping, so that is causing forming a fold, and so that is coming in the way of her some vision also. So and there is in the neck, it is a neck fullness is there, that is a double chin is there, lot of fat here. You can see this pinch. There's a lot of fat here. Along with that, some bands are there. So now the with all these signs, the plan is the facelift. Facelift incision comes here. So in the hair bearing area and comes in front of the ear and it goes behind the ear. So once it is well healed, so this nobody can make out the any incision mark. For the eyebrow lift, so I'll be making incision within the hairline here, and I'm going to perform a gliding brow lift. So I'm going to elevate the lateral eyebrow, giving her a nice shape for the eyebrow. At the same time, this periorbital area is also rejuvenated, less wrinkles and other. So here I am going to make an incision for lower blepharoplasty. Her lateral, the canthus is, the lower eyelid is very loose. So it is very loose now. So I'm going to fix that, tighten it up and fix laterally so that it is having a youthful appearance there. So here if I tighten it up, so the one there will be less movement there. So I'm going to fix that. That is called as canthopexy. And there are a lot of fixed structures here to be released. That is the zygomatico-cutaneous ligament, mandibular ligaments, the mesenteric ligaments, the zygomaticus major, some ligaments are which are there to adherent there. So this is called as deep plane facelift. Here is the entry point for the deep plane facelift. So from there, I am going to tighten the smash layer, smash. So the submuscular aponeurotic layer, so which is a facial layer. So I'm going to fix that and give a tightened look. or a natural, the improvised look will be there. So in the neck, so I'm going to make a small incision in the submental area here. Um, Submental area here, small incision. With that, of course, I'm going to perform liposuction for entire neck, and also at the same time, I'm going to do a platysmoplasty. So this is about the neck lift. So the whole procedure will be done under general anesthesia. And once again, I'll come back once the procedure is over. I'll explain about the how the results are there. So the even the mouth commissure the is also down with the age. So we are going to correct it with a normal horizontal position or an elevated position to give a youthful look. With few, there will be a droopy or elongated upper lip. So we in that case we usually do a lip lift procedure, but in this case the lip length is normal, so I'm not planned about that. And in some cases rhinoplasty may be required. So in those cases we do perform rhinoplasty, but in this case she felt her nose is okay, so we are not going to disturb the nose. So we are going to basically follow the four techniques for overall facial rejuvenation. That is a facelift, neck lift, blepharoplasty, and eyebrow lift. So now we are done with our facelift procedure. We have done the deep plane facelift, gliding brow lift, blepharoplasty, that is pinch blepharoplasty, and also the neck lift along with the neck liposuction. So this there are so many varieties of facelift procedures. So everybody will be concerned which one will be good or good for them. So we usually, there are standard facelift procedure or a classical facelift procedure is there, where only the skin tightening was done very long before, but because of the actual problem is in the deep plane, that is called as in the smash layer, the relaxation in the smash layer, the thinning of the skin, and the loss of volume are the main factors which causes the signs of age. For that reason, the deep plane facelift, which lifts the smash layer, will give a better rejuvenation compared to other techniques. So other techniques are like max facelift, so wherein we just do a tightening of the smash, but we're not dissecting below and not releasing properly. So it is not so effective as the deep plane facelift. Um, the client will stay overnight, and only overnight. So next day morning we are going to discharge. So there will be a lot of plasters in the face to control the swelling. So they will be but okay to have the normal food from same, from today evening itself. From tomorrow also they can have the normal diet, preferably the soft diet. Just because of a lot of swelling and the facial plasters, they need to stay at home for next 2 to 3 weeks. We usually remove the plasters after 1 week. So after 1 week, the if we would have put very small stitches in the just in the front of the ear, in the eyebrow region. So these stitches are removed after 1 week. So after that, some swelling will be there, but some swelling will reduce gradually over a period of 3 weeks to 1 month. They can have comfortably face wash, head bath, everything after 1 week. So because of swelling, they need to be at home for 2 to 3 weeks, and after that they can resume their social activities. So more or less, the once the swelling is well settled, by the end of 1 to 1.5 months, so they can appreciate the good final results, rejuvenated face, and also when the scars will would have healed very well.